So there are two different terms that are used to describe placentas that are found lower down in the uterus, and they are important to distinguish because they are managed slightly differently. So a low-lying placenta is just a sort of initial screening result. So at the 20-week scan, if the edge of the placenta is within 20 millimeters of the internal cervical os, then it is categorized as being a low-lying placenta. So this just means that it requires a bit more monitoring. However, the good thing is that during the pregnancy, the placenta sort of grows outwards like a balloon, and hence the placenta should actually move away from the internal cervical os. So with regards to the monitoring, the patient should be rescanned at 32 weeks, and if the edge of the placenta is still within 2 centimeters or 20 millimeters of the internal cervical os, they should be rescanned at 36 weeks. And if they are still within 2 centimeters, then it suggests that a vaginal delivery is going to be quite dangerous, and an elective C-section should be planned. So placenta previa, on the other hand, is diagnosed when at the 20-week scan the placenta is actually covering or almost covering the internal cervical os. So these patients may actually present having had an antenatal hemorrhage where they have a little PV bleed, and a scan will reveal that they do actually have placenta previa. So with any antenatal hemorrhage, it's important to think about the rhesus groupings of the patient and the baby. If the patient is rhesus negative, then something called a Kleinhower Test is important. It essentially determines how much the fetal blood has mixed with the maternal blood, and hence determines how much anti-D antibody you need to give. That's something that will be discussed in a different video. A CTG is important to see whether the baby is doing okay. Growth scans and umbilical artery Dopplers are done for the same reason. An ultrasound should be done at 37 weeks to determine the method of delivery. It's very likely that the patient will need a cesarean section. If the patient has a significant antenatal bleed, they'll need to be admitted. They'll need steroids as well to help the fetal lungs mature if the gestation is from 24 to about 37 weeks. And if there is any suggestion of fetal compromise, then they will need immediate delivery.